taken an unprecedented crisis to make everybody realize just how vitally and crucially important it is to do as much as possible at European level for health. Obviously, it's not only the COVID crisis, but I would like to refer to a specific issue that we've been discussing here from the hemicycle for a number of years, and that is rare diseases. These patients who are quite often forgotten because they live hundreds of kilometers or more away from their specialist doctors. And we've been putting out feelers to look at other kinds of instruments, online diagnosis, other kind of platforms, Orphanet, for example. And these are very important tools. And I'm very happy to hear that the Commission wishes to disseminate these and broaden them, but in particular for cancer, but not at the cost of rare diseases, because we need the budget for rare diseases to be strengthened and to be rendered more permanent. So that is an appeal I'd like to set out. Yes, if we make the fight against rare diseases a priority, that's fighting for the health of all European citizens.
Thank you very much. Our next speaker is our colleague Bardella.
Thank you, President. Understanding too late, taking action too late, and probably, just to paraphrase MacArthur, when the tsunami was incoming, when drastic measures were underway in China, all the European Union did in this crisis was to say to countries who had re-established national borders that that wasn't the right thing to do. Posting tutorials about how to wash your hands, but nothing about masks, tests, or relocalizing our medical production industry. And this inertia pushed countries like Italy into China's arms. The text that we're being presented with here is supposed to signal the creation of a European Health Union. But this union's existed for years, certainly when it came to calling on countries to fill up the coffers of the EU for healthcare policies. 2 years ago, in 2018, the EU recommended the member states cut spending on healthcare. Pushed by the EU, Spain itself cut its healthcare spending by 11% over the past decade. And so it's rather cynical that the Commission is asking Spain to invest in its healthcare to repair the structural problems revealed by the pandemic. The EU is denouncing an ill that it itself has caused. Millions were cut in the Italian government's spending on health, and there are now 50% fewer beds in Italian hospitals. Healthcare, public healthcare, is the exclusive purview of member states. Of course, we are in favour of cooperation among sovereign member states to fund research projects, and we would like to see significant funding on this. But for this cooperation to be effective, it must be as flexible as possible amongst member states and not under the auspices of a bureaucratic superior organ. Thank you.
Thank you. Our next speaker is our colleague Paulus from Munich.
Thank you, Madam President. Ladies and gentlemen, dear colleagues, it is sad that it took a pandemic for us to realize that we need a common health program. And in this health program, which is fine enough, but I don't see any consistent work health approach, a healthy environment for healthy people. I will focus on point 7, i.e. the threat through antibiotic resistance. This has been addressed, but far too late and hesitantly. We need more strict rules for animal welfare, and in Switzerland they use far fewer antibiotics. And please, it's about time that environmental criteria be included in the appropriate recovery practice, which should apply worldwide. The production areas and many people are dumping waste into the water, and this is meaning that antimicrobial resistance is happening more and more. We need to act quickly. Thank you.
Thank you very much. Our next speaker is Mr. Ferreira from Lisbon.
Yes, thank you very much, President. The consequences of years of a lack of investment or underinvestment in the health sector to open the doors to greater marketing commercialisation, well, these shortcomings have now been highlighted by the pandemic. So who is responsible? Where do the responsibilities lie? We have the Stability Act, there are obligations under the European semester, which have brought about a cut in budgets, fewer personnel. If we take a look at the programme, the EU4Health Programme, it's almost as if it's to give us a good photo opportunity so that we look good. But there are a number of negative aspects that have to be corrected relating to sovereignty national aspects. And we need more resources into public health, and we have to invest in prevention, diagnostic, infrastructure, then the professional teams, the personnel, and also look at the patient and look at having adequate support.
Thank you. Our next speaker is Mr. Comini Oliveros.
Señora Presidenta, los sistemas de salud de los Estados miembros.
Thank you, President. Member states are facing huge challenges when it comes to healthcare. But we've also had to deal with the increase in life expectancy, cancer, rare diseases, old and new infectious diseases like COVID, or mental illnesses as well. Inequalities in health among countries, regions, social classes, genders, the structural discrimination in health, the impact of the environment. These are just a few factors involved in our healthcare systems. And we need more research. The One Health paradigm. We need to believe in the concept of health being integral to all policies. And we need to ensure there is harmonization across health systems, in medical technology, in innovation in different types of therapy. If we're able to tackle all of this on the European level, we'll be able to move forward more quickly and go further. We need a European health policy, and the EU4Health Programme is going in the right direction. Thank you.
Herzlichen Dank.
Yes, thank you very much. And then if we move on to the next speaker, Mr. Radan Kanif.
Mr. Chair, colleagues, people's health and life are once again centre stage. During the spring, Eastern Europe was not affected so strongly. In my country, the pandemic was a reason to brag about your success. Now, however, it shows how poorly prepared our institutions are. In my country, Bulgaria, infection and mortality rates are equal to Italy's. The worst affected are doctors, teachers, parents. Europe has shown that it can help if it is united and that it can compensate for losses. In those cases where the passivity of governments led to poor results. Today, people expect the European Parliament to come up with clear rules to help create a fair market of pharmaceuticals. The hope that everyone will have access to them. Our hope is that a vaccine will soon be made available with the assistance of the EU. The success shows the importance of investment in science. What matters is to make this vaccine available to citizens on the basis of clear rules. Thank you.
The next speaker is Mr. István Ujhelyi.
Mr. President, Madam Commissioner, it is impossible to tell the story of years of work which culminates today. So I would like to thank everybody, the rapporteur, the political groups in the European Commission, for making it possible to finally put the creation of the European Health Union on the agenda. We've been fighting for this for years, and I am very proud of the Socialist Group, which welcomed our proposal. As a Hungarian, the starting point of my idea was that I wanted to fight for the right of a person living in a small village somewhere in the countryside of Hungary to have the same access to healthcare as someone living in Brussels, for example. So I am very glad that we are going to do this. Now it's time to act. Thank you.
Thank you.
Thank you very much. I'd now like to hand the floor to Mr. Lefteris Nikolaou Alavanos.
The intensive care units in the European Union have reached the red line, the limits, and the doctors have to decide who lives and who dies because of the we don't have the capacity. We're trying to protect the health as a commercial good, and we have hundreds of thousands of deaths. You are celebrating for the vaccine, but there is competition between the pharmaceutical industry companies in that, and this is dangerous for health. And we do not know the terms of the contracts to be signed. You give to the banks 1.7 trillion, but you give only 9 billion for health. And this will not be given to public structures, but for cooperation between the private and public sector. And the people will pay for that. We should take the private clinics and to be used by the public sector to use tests, examinations that will be done for all forms of disease. We have to open intensive care units. We have to have prevention measures at work and all people's homes and means of transport. Thank you.
Thank you. Mrs. Maria Grazia Carvalho.
O novo programa para a saúde é passo em frente na construção europeia. Prova, mais uma vez.
A new programme for health is what we need. Proof that we're not only an economic and monetary union, but also a union of people and for the people. Strengthening the Europeans' remit when it comes to health, something that's so essential in the fight against COVID-19, has a whole array of benefits when it comes to putting together policy meant to fight illnesses, including pandemics. The cooperation will ensure better scientific collaboration as well, from research to clinics. May I make the most of this to express my delight at the creation of a European biomedical cooperation scheme. It's also going to be necessary to create a European health database, a joint database. We could do this for cancer and for cardiovascular illnesses as well, among others. So it makes a lot of sense for us to share our knowledge, seeking solutions that will benefit all, and respecting and upholding the confidentiality of the personal data of our citizens, adopting measures that will guarantee that confidentiality. With this joint health data area, there's a lot we stand to gain. Thank you.
Thank you. Luena Cesar next.
Sí. Gracias.
Yes, thank you, President. Health is one of those issues that is of great concern to the citizens, and you can see this from Eurobarometer surveys. And we know, of course, that health is in Article 35 of the Charter of Fundamental Human Rights. And I'm very happy that the budget is now much higher. It's tripled. And there are 5 main serious challenges: overcome health inequalities, have greater crisis preparedness, improve health cover in the European Union, tackle environmental challenges related to health and also pharmaceutical substances, and obviously introduce the digitalization of health systems. I can support the amendments of my group to carry out health stress tests in order to evaluate the capacity of our health systems to be able to cope in situations like the one we have at the moment. We need to count on a system which will allow us to detect zoonoses, for example, to prevent current problems like the mink farms in Denmark, make sure they're properly under control.
Before we hear from the Commissioner, I'll give the floor to Mr. Kohut.
President, dear colleagues, in May of this year, the Commission submitted a proposal for health over the next 7 years, and we're already in the pandemic crisis, and it was quite clear that in this fight against the pandemic, we didn't have enough tools and instruments and finances. Cynics said, well, you know, the health systems would cope, but we do need money. And we've seen that, fortunately, after the negotiations, that even though the Council wanted to allocate less, we now have more money for health. And this is really good, because our citizens' health is absolutely essential. This has shown solidarity across the European Union, and when we do act together on the basis of solidarity, we're a lot stronger. And we have drawn the lessons and conclusions that from this solidarity, because now in the second wave of the crisis, member states are helping each other. And we've seen that Germany is helping other countries as well. Unfortunately, the Polish government is not acting in this way, but in Silesia, we're doing everything possible